Welcome everyone. In this video or lesson, we will be focusing on measuring health, epidemiological rates, and indicators. Now, in epidemiology or in every community, numbers tell a story. In every community that you enter, numbers within the community, it tells a lot of stories about the community. Now, it can tell a story about how healthy, numbers can tell a story about how healthy the community is. Okay, numbers can let us know which people are getting sick, who is getting sick, or who is sick. Okay, and numbers can let us understand how diseases affect population over a period of time. Okay, now, for us to truly understand that story, epidemiologists don't just count the cases. They measure what we call rates. Okay, they measure what we call rates. Okay, now epidemiological rates and indicators are like the language of public health. So in public health, one of the language of public health is epidemiological rates and indicators. Now, what they do is that they transform, and the epidemiological rates, your understanding is going to help you transform simple numbers into meaningful informations that can help you to track diseases, to identify people who are at risk of diseases, and also to guide life-saving decisions, to help epidemiologists and public health practitioners to, making life-saving decisions. Now, another thing you should think about is that, let's say in a community or in a particular population, 400 people have malaria. Is that okay? It sounds alarming. So if you tell you 500 people, let's say 500 people have malaria, it sounds alarming anyway. Okay, but it does not mean the situation is worse in a city of 5,000 people. Okay, or in a region of, let's say, 5 million people. Okay, good. If someone just enter a community, comes out and come and tell you, 20 people are having malaria, it may sound so alarming to you. But if we go further to tell you that, okay, the population of the community is, let's say, 5 million people, if you are comparing it, it may not sound that alarming. Is that okay? Because if you have 5 million people, 50 of them are having malaria, it's not something that is so alarming. But if we tell you that just 50 people, without giving you the population, you may not be able to, make a very good conclusion from it. And that is why we use rates. We measure rates. We calculate for rates in epidemiology. Okay, to make a fair comparison and also to reveal the real impact of diseases within populations. Is that okay? So in this very lesson, we would explore the key epidemiological indicators, how to measure them. Key epidemiological indicators like incidence, like prevalence, like all that comes under morbidity, like mortality, okay, case fatality, how to calculate attack rates. Okay, then we will see how each of them play vital roles in understanding disease patterns, and then also evaluating public health intervention. Okay, now by the end of this video, you would see that epidemiological rates, they aren't just statistics, they aren't just calculations. We are not learning epidemiological rates to just come and do calculations. That is not the whole purpose of epidemiological rates. Okay, they are powerful tools. They are powerful mathematical tools that would help us as epidemiologists to monitor and also to prevent and control diseases, to help you understand the reality of the impact of a situation in public health within populations. Okay, so let's get started. Now, what are epidemiological rates, or what are rates in general? Now, when we say rates express proportion of people with a health problem in a population at risk. Okay, so rates, they express the proportion of people, okay, with a particular health problem in a population at risk, usually within a defined population or a sample. When you are calculating rates, we usually calculate rates within a defined population or a sample from the population. Now, like we said earlier, the purpose is to help public health professionals understand the frequency of a disease. Now, the reason why we are going to learn about rates and perform all the calculations under rates is to help you understand the frequency of diseases, the trend of diseases, and people who are at risk of diseases. That's the main idea. Okay, now, for example, if you say the number of malaria cases per 1,000 population in a district, the number of malaria cases per 1,000 population in a district. Okay, so if you take a population of 1,000 people, and let's say the number of malaria cases is 50. Okay, that means that in a population of 1,000 people, 50 people are getting malaria, or 50 out of 1,000 people, okay, are affected by malaria, okay, in that population in a defined period of time. Is that okay? Now we will start with morbidity rates. Morbidity. Okay. Now when we say morbidity, morbidity simply means the relative occurrence of disease in a population. The relative occurrence. The occurrence of a disease or an illness in a given population. That is morbidity. Now in epidemiological rates, we will look at two forms of measuring the occurrence of disease in the population. We have two forms of it. We have incidence and then we have prevalence. Now, when we say incidence basically is the number of new cases over a period. Okay, the number of new cases. So if you look at the diagram over here, this is incidence. You see the tap is flowing. The new ones that are coming out is the incidence. Okay, so the occurrence of what? New cases over a period. That is incidence. The occurrence of new cases over a period. That is incidence. Okay, good. So this is incidence. So let's say this is the source of the infection. The new cases that are coming here, that is representing the incidence. Okay. Now we have prevalence. Prevalence is the number of all existing cases. That is new cases plus old cases at a point over a period of time. Okay, that is prevalence. Okay, so this is prevalence. Okay, so the prevalence is the new cases plus the old cases. So the new ones that have already flown inside, okay, plus the new ones that are coming, they form the prevalence. Okay, so when we say prevalence, we are looking at new cases plus old cases at a point in time. Okay, that is prevalence. And you know, within the prevalence, some people will recover. Within a prevalence, a portion or a proportion of the prevalence will recover. Some would also die. Is that okay? But at the end, the new cases plus the old cases, they form the prevalence. And then the new cases at a point in time form the incidence. But within this incidence, some of the people, within the prevalence, okay, which basically is the number of all existing cases, some of them will definitely recover or will get healed. Some of them will also end up dying. Is that okay? Good, within the prevalence. And that transition us to other epidemiological rates, like the mortality rate, because you see some of the cases over here, some will end up dying. Some of the cases over here will end up recovering from the disease. Okay, good. So morbidity rate is just a relative occurrence of disease in a population. And we have two forms of it, incidence and then we have prevalence. Incidence is just the number of new cases, okay, over a period of time. Prevalence is just the number of existing cases, that is new cases plus the old cases at a point in time or over a period. Is that okay? So example, incidence rate of typhoid fever, new cases per 1,000 per year. So when we say incidence of typhoid fever, we are just looking at new cases of typhoid fever. Okay, when we say we have something we call point prevalence of hypertension. Okay, the number of existing cases at a clinic on a specific day. Okay, when we say point prevalence, usually we are looking at a specific period of time, a specific point in time. Is that okay? A specific point in time. That is when we use the word point prevalence. Okay, so sometimes they will use point prevalence. Okay, good. Now let's now move on to the morbidity rates. Okay, morbidity rates. Now let's start with incidence rates. Now incidence rate is the proportion of new cases in a population during a specified time. The proportion of new cases in a population during a specified time. Now the formula for incidence rate is the number of new cases in a period over the population at risk during the same period. Then you multiply by 1,000. Okay, so incidence rate is the proportion of new cases in a population during a specified time. Now the formula is incidence rate is equal to the number of new cases in a period over the population at risk during the same period. Then you multiply by 1,000. Now, a practical example is we have 50 new malaria cases occurred in a town of 5,000 people over 1 year. 50 new malaria cases occurred in a town of 5,000 people over a 1 year period. 50 new malaria cases occurred in a town of 5,000 people over 1 year. Now, the calculation, let's calculate the incidence rate. What is the formula for incidence rate? The number of new cases in a period divided by the population at risk during that same period. Then you multiply by 1,000. Now, from the question, what is the population? The population is 5,000. How many malaria cases? 50. So we are going to have the incidence rate as 50 over 5,000. Then you multiply by 1,000. In the end, if you perform your calculation, you are going to get 10. Now, in writing the answer, you always write 10 per 1,000 per year. The reason because you multiply by 1,000, so you are expressing the answer in thousands. Okay, so 10 per 1,000 per year. What that means is that 10 out of every 1,000 people in the population got malaria that year. That's the meaning. 10 out of every 1,000 people in the population got malaria within that year. Let's go over it again. The formula for incidence rate is the number of new cases in a period divided by the population at risk during that same period. Then you multiply by 1,000. Now, an example. We have 50 new malaria cases occurred in a town of 5,000 people over 1 year. Now, let's calculate for the incidence rate. What is the formula? Number of new cases over the population at risk. Then you multiply by 1,000. What is the number of new cases? We have 50 new malaria cases. It's specified in the question. And what's the population of the town? 5,000 people over a year. Okay, so that means the incidence rate is 50 divided by 5,000. Then you multiply by 1,000. You get 10. What that means is that, you see, you expressed your answer in 1,000. So what that means is that it's 1,000. You always write your answer 1,000 per 10 per 1,000 per year. Assuming you had 20, it will be 20 per 1,000 per year. And what that means is that out of every 10 out of every 1,000 people in the population got malaria that year. So if you take every 1,000 people in the population, 10 of them got malaria that year. That's the meaning. Now let's look at the example 1. In a town of 10,000 people, 50 new cases of tuberculosis were reported in 1 year. Calculate the incidence rate. Yeah, so you use the formula, new cases. The number of new cases is 50. The population at risk during the same period is 10,000. So 50 divided by 10,000. Then you multiply by 1,000. The answer you get, you express that answer per 1,000 per year. Do you get it? Great. The example 2 to the same format. A community of 25,000 residents recorded 125 new cases in 2024. Find the incidence rate of malaria for that very year. A community of 25,000 residents recorded 125 new malaria cases in 2024. Find the incidence rate of malaria for that very year. Okay, let's move on to the next. So in the example 2, for example, if you want to calculate the incidence rate, the population at risk is 25,000 residents. How many cases? 125 new cases of malaria. So the formula, number of new cases in a period divided by the population at risk. The number of new cases is 125 divided by 25,000. Then you multiply by 1,000. Is that okay? The answer you get, you express it in within 1,000 per year. Let's move on to the next morbidity rate, which is the prevalence rate. Now, when we say prevalence rate is the proportion of all cases or the proportion of the total cases. So the proportion of all cases or the proportion of the total cases. Now, proportion of all cases, that is the new. When we say all cases, we are looking at new plus existing. The new cases plus the existing cases. So the proportion of all cases, that's the new plus existing cases at a specific period of time. Okay, good. Now, the formula. Let's look at the formula. So prevalence rate is equal to the total cases at a point in time over the population at risk. Then you multiply by 1,000. So the total cases at a point in time over the population at risk. Then you multiply by 1,000. So let's look at our first example. So the first example states that 200 people have hypertension in a town of 10,000 people. So we have 200 people who have hypertension in a town with a population of 10,000 people. Okay, so let's work this out. Now, the formula for prevalence rate states that total cases at a point in time over the population at risk, you multiply by 1,000. What is the total cases? 200 people have hypertension. You see over here, we didn't state that 200 new cases of hypertension. 200 people. So we are looking at both new and old, existing. Okay, both the new and then the existing case, or both the new and old cases. Okay, so 200 people have hypertension in a town of 10,000 people. Okay, so prevalence rate is equal to 200 over 10,000. Then you multiply by 1,000. In the end, you get 20. And you express it 20 per 1,000 per year. Is that okay? 20 per 1,000 per year. And what that means is that 20 people per 1,000 population have hypertension. So if you take that particular year, okay, if you take any 1,000 people from the population, 20 of them had hypertension. Okay, 20 people per 1,000 population have hypertension. So if you take within that population, if you take any 1,000, you count any 1,000 people from the population, 20 of those people had hypertension within that same time. Okay, that is what it means. Let's look at the questions. Question 1. In a population of 8,000 people, there were 160 existing cases of hypertension, which means both new existing cases. You see, we've qualified it in the question that both new and old. Okay, it will always be qualified in the question for you. Or sometimes they will say 200 people and they wouldn't add new to it. Once you don't see new, it should tell you they are dealing with the total cases. Okay, calculate the prevalence rate of hypertension. Okay, so the population at risk is 8,000. There were 160 existing cases. Okay, existing. So we are dealing with, and then we even qualify the existing cases of hypertension into bracket both new and old at the same time. Okay, so that should tell you the total population, the total cases, that is new and old, is 160. So you are going to get 160 over the population at risk, which is 8,000. Then you multiply by 1,000. In calculating morbidity rates, we always multiply by 1,000. Remember when we were calculating incidence rates, you have to multiply by 1,000. Calculating prevalence rate, one clue, you have to multiply by 1,000. Remember, for all the morbidity rates, incidence rates, and then prevalence rates, you always multiply by 1,000. you always multiply by 1,000. That is one clue that can help you to remember. Now, question 2. During a health survey in 2025, a city with 100,000 residents reported 3,000 people living with diabetes, including the old and new cases. Okay, so, and that is prevalence. Determine the prevalence rate of diabetes. What's the population of the city? 100,000 people. Okay, how many residents reported 3,000 people living with diabetes? That is old and new, and that's the prevalence. So in your calculation, your numerator is going to be the 3,000, your denominator is going to be the 100,000. Then you multiply by 1,000 because we are doing prevalence or morbidity rate. Okay, so 3,000 over 100,000, then you multiply by 1,000. Then the answer, you express it in 1,000. So whatever answer you get, so for example, the prevalence that we had 20. So 20 people per 1,000 per year. So that means that if you take any 1,000 people from the population, 20 of them are likely to have hypertension. That is the meaning. Okay, let's move on to another rate in epidemiology that we call the attack rate. The attack rate. Now, the attack rate is the proportion of people exposed to a risk who develop a disease. The proportion of people exposed to a risk who ends up developing a disease. Okay, now, in epidemiology, the formula for attack rate is the number of people who develop a disease over the number of people exposed to the disease. In calculating attack rate, we always express it as percentage. In calculating attack rate, we always express the answer in percentage. In calculating attack rate, we always express the answer in percentage. Now, the proportion of people exposed to a risk who develops a disease. Now, the formula for attack rate is the number of people who developed the disease over the number of people who were exposed to the disease, or the total number of people who were exposed to the disease. Then you multiply by 100. Okay, now let's do our first example. Now, 30 out of 100 people were exposed to contaminated water. Okay, so 30 out of 100 people exposed to contaminated water developed cholera. 30 out of 100 people exposed to contaminated water developed cholera. So that means that how many people were exposed? 100 people were exposed, and 30 of them developed cholera. So, okay, so the number of people who developed the disease is 30. And then the number of people who were exposed to the contaminated water, 100. So 30 divided by 100. Then you multiply by 100. You get 30%. Okay, remember that in calculating attack rate, you always have to express your answer in percentage. Your answer would not be greater than 100%. Your answer will not be greater than 100% when you are calculating attack rates. Okay, so the formula states that the number of people who develop a disease over the number of people exposed, then you multiply by 100. Okay, so a typical example, 30 out of 100 people exposed to contaminated water. So meaning 100 people were exposed to contaminated water. 30 of them developed cholera. Okay, so what is the number of people who developed the disease? 30 people developed the disease. How many people were exposed to the contaminated water? 100 people were exposed to the contaminated. Then you multiply by 100, you get 30%. So the interpretation is that 30% of the exposed population got cholera. That's the meaning. And you see, you shouldn't just be interested in performing the calculation. The interpretation is more important in epidemiology. Okay, so 30% of the exposed population got cholera. 30% of the exposed population got cholera. Now, let's look at our first question. At a wedding attended by 200 guests, 50 people developed food poison after eating salad. Calculate the attack rate of food poison among the guests. So, how many people attended the wedding? 200 guests, meaning they are the people that were exposed. Okay, so that will form the denominator. Okay, so we are going to have 50 divided by 200, multiply by 100. 50 divided by 200, then you multiply by 100. Then you get the attack rate. So whatever answer that you are going to get, it means that that percentage, the percentage of the exposed population, that percentage of the exposed population got malaria. That's the meaning. Now let's look at the question 2. During a measles outbreak in a school, 120 students were exposed and 90 became infected. So that means 90 over 120 times 100. 90 over 120 times 100. So the attack rate is basically letting us understand the number of people who developed a particular disease among a group that were exposed. Among a group that were exposed, okay, to the source of the disease or the cause of the disease. Is that okay? That is the attack rate. Now, let's now start calculating mortality rates. Okay, mortality rates. Okay, now with mortality rates, we will begin with crude mortality rates. Okay, crude mortality rates. Now, crude mortality rates is the total deaths per population per year. The total deaths per population per year. Okay, the total deaths per population per year. Now, the formula for calculating crude mortality rate is the total death in a year over the mid-year population. Then you multiply by 100,000. So the crude mortality rate is the total death in a year over the mid-year population. Then you multiply by 100,000. The total death in a year over the mid-year population. Then you multiply by 100,000. The total death in a year over the mid-year population. Then you multiply by 100,000. Let's do our first example. So the first example, 450 deaths in a population of 90,000 in a year. So we are recording 450 deaths in a population of 90,000 in a year. What is the formula? The total death in a year. What is the total death in a year? 450. So this is the total death in a year, 450. What is the population? 90,000. Don't worry about this mid-year population. Just use the population. Mostly in the formula, it's mid-year population. There are times that the question will be presented to you and they will specify mid-year population. But even if it's not specified mid-year population and they just write population, still use that same population. Okay, so 450 deaths in a population of 90,000 in a year. Okay, now let's calculate the crude mortality rate. 450. So the total death is 450 over what is the population? 90,000. Then you multiply by 100,000. Now, one thing about calculating all mortality rates is that you always multiply by 100,000. The moment you hear you are going to calculate mortality rates, you should know you definitely multiply by 100,000. That is one of the tricks you can use. The moment you hear you are going to calculate morbidity rates like prevalence, incidence, you are going to multiply by 1,000. That is one trick you can use. Okay, so in mortality rate, crude mortality rate, 450 divided by 90,000, then you multiply by 100,000. So at the end of the day, you are going to get 5,000 per 100,000 per year. 5,000 per 100,000 per year. 500 per 100,000 per year. 500 per 100,000 per year. Let's look at this example. In a community with a mid-year population of 25,000, there were 320 deaths recorded in 1 year. Calculate the crude mortality rate. Now, in calculating the crude mortality rate, the total death, how many deaths were recorded? 320 deaths recorded in a year. So 320 divided by, what's the mid-year population stated in the question? 25,000. Okay, 25,000. Okay, then the answer, you multiply by 100,000. Okay, so you are going to get 1,280. So 1,280 per 100,000 per year. 1,280 per 100,000 per year. You can also perform the calculation for yourself. Now, question 2. A district recorded 1,050 deaths in 2024 with a mid-year population of 70,000. How many deaths? 1,050. Okay, what is the mid-year population? 70,000. Okay, then you multiply by 100,000. You are going to get 1,500. Okay, so that means that you are going to express your answer this way: 1,500 per 100,000 per year. 1,500 per 100,000 per year. Okay, so in calculating crude mortality rate, we are looking at the total death in a year. The total death in a year. Okay, so the total death in a year over the mid-year population, then you multiply by 100,000. The total death in a year over the mid-year population, then you multiply by 100,000. Now let's do this one, the cause-specific mortality rate. Now in epidemiology, we can sometimes refer to the cause-specific mortality rate as the case-specific mortality rate. The case-specific mortality rate or cause-specific mortality rate. Now, cause-specific mortality rate simply refers to death from a specific cause per a population. Okay, the death per specific cause within a certain population. Is that okay? That is different from crude. Crude looks at death from all causes. Okay, but cause or case-specific mortality rate just look at the deaths that are connected or linked to a specific cause within a population. So, for example, cause-specific mortality rate, the formula is the death from that specific disease. Okay, the death from that specific disease alone divided by the population at risk. You multiply by 100,000 again. Remember, in fact, all mortality rate calculations, you always have to multiply by 100,000. Okay, let's do an example. 75 deaths from malaria in a population of 90,000. There are 75 deaths from malaria in a population of 90,000. Calculate the cause-specific mortality of malaria. Now, the formula states that the deaths from that specific cause. What is the deaths from the specific cause? Malaria is the cause. 75 deaths. What is the population at risk? 90,000. Is that okay? So the death specific mortality rate is for malaria is 75 over 90,000 times 100,000. Okay, the cause specific or the case specific mortality rate. Now, in a town with a mid-year population of 80,000, there were 48 deaths due to malaria in 2024. Calculate the cause-specific mortality rate for malaria. In a town with a mid-year population of 80,000, there were 48 deaths due to malaria in 2024. Calculate the cause-specific mortality rate for malaria. Now, there were how many deaths? 48 deaths due to malaria. So it means the cause of the death, malaria, 48 people died from malaria. Now, what is the population at risk? 80,000. So we are going to have 48 deaths over 48 over 80,000. Then you multiply by what? 100,000. Now, question 2. A city with a mid-year population of 250,000 recorded 500 deaths due to heart disease. Okay, so what is the specific case or cause over here? Heart disease. How many people died from heart disease? 500. What is the population at risk? The population at risk is 250,000. Then you multiply your final answer by 100,000. Then you are going to get 200. Okay, so 200 per 100,000 per year. So the cause-specific mortality for heart disease is 200 per 100,000 per year in that population. 200 per 100,000 per year. 200 per 100,000 per year. Now, the difference between cause-specific mortality and then crude mortality, cause only uses the deaths that are occurring as a result of a specific case or a disease as the numerator. But then they all use both the population at risk as the denominator. Is that okay? Great. That's the cause specific, or you can call it the case specific mortality rate. The case specific mortality rate. Now, let's look at the case fatality rate. That is also a different thing. Case fatality. This one was cause specific mortality rate or case specific mortality rate. This one is case fatality rate. Now, in calculating case fatality rate, the difference is the denominator. Okay, the difference between the case fatality rate and then the cause specific mortality is the denominator. Now, the case fatality rate is the proportion of death among diagnosed cases. Here is the proportion of death from a specific cause among the population at risk, not those who have been diagnosed. But then with the case fatality rate, you are going to use the diagnosed cases within the population as the denominator, not the entire population at risk. Okay, so when we say case fatality rate, okay, the proportion of deaths among diagnosed cases. Okay, so the formula is for case fatality is the deaths from a particular disease over the total diagnosed cases, then you multiply by 100. Now, in measuring case fatality rate, you express the answer in percentage. Okay, you express your answer in percentage. Okay, so let's move on to the calculations. Now, case fatality rate. Let's look at our first example. 5 deaths among 100 diagnosed Ebola cases. 5 deaths among 100 diagnosed Ebola cases. 5 deaths among 100 diagnosed Ebola cases. Calculate the case fatality rate. How many people died from Ebola? 5. How many of them were diagnosed? 100. Okay, so 5 over 100, and you multiply by 100, you get 5%. Okay, so the interpretation is that 5% of infected patients died. Now, the case fatality will let you understand the entire population, those who were affected, because those who were diagnosed are those who were affected. So the case fatality would help us to be able to measure the number of people who are dying among the infected population, not the entire population. Okay, that's the difference between the case fatality and then the cause specific mortality. Okay, the case fatality will let us appreciate among those who are infected with the disease, how many of them are dying. The case fatality rate. Is that okay? Let's look at this question. During a cholera outbreak in a community, 400 people were diagnosed and 20 people died from the disease. Calculate the case fatality rate. During a cholera outbreak in a community, 400 people were diagnosed and 20 people died from the disease. Calculate the case fatality rate. How many people died? 400 people were How many people were diagnosed? 400 people. How many people died? 20. So the answer, the calculation is going to be 20 over 400, and you multiply by 100. In a hospital, 150 patients were treated for COVID-19 and 6 of them died. Once you are in the hospital, you should know those 150 people, they were diagnosed, because the hospital, they wouldn't treat anyone with COVID-19 without making a diagnosis. Okay, so in a hospital, 150 patients were treated for COVID-19 and 6 of them died during the year. Find the case fatality rate. Now, to calculate for the case fatality rate, how many people were diagnosed? 150. How many people died? 6. So 6 over 150, then you multiply by 100. 6 divided by 150, you multiply by 100. Now, remember that the difference between case fatality and then cause specific is that cause specific, they all use specific case or condition, the death from a specific case or condition. But then cause specific mortality uses the entire population at risk as the denominator. But case fatality rate uses the people who were diagnosed for that very disease as the denominator. Then again, we express cause specific mortality in 100,000s, but we express case fatality rate in percentage. Now let's look at maternal and infant mortality rate. Maternal and infant mortality rates. Now, what is maternal mortality rate? Now, the formula for calculating maternal mortality rate is the maternal death in a year. Maternal death in a year. Okay, the maternal death in a year over the live birth. Maternal birth in a year over the live birth in that same year. Then you multiply your answer by 100,000. So the maternal death in a year, maternal death in a year over the live birth in that same year, then you multiply by 100,000. Now, one clue you always have to remember, if you are dealing with mortality rate, you always multiply by 100,000. Now, let's do our first example. 30 maternal deaths, okay, and then 10,000 live births. Okay, so in a certain population, we have 30 maternal deaths, and then the live birth is 10,000 live births. Let's calculate the maternal mortality. That will be 30 over 10,000, then you multiply by 100,000. Okay, the answer is going to be expressed or interpreted this way. So 300 per 100,000 live births. Okay, so 300 per 100,000 live births. Now, infant mortality rate. Infant mortality rate, the formula for calculating infant mortality rate is infant death. Okay, so infant, we are looking at less than 1 year. So infant death over live birth, then you multiply by 100,000. Infant death over live birth, then you multiply by 100,000. Infant what? Death over live birth, then you multiply by 100,000. Now, let's do our first example. 45 infant death, and then the live birth is 1,500 live birth. Now, the infant mortality rate will be 45 over 1,500, then you multiply by 100,000. The infant mortality rate will be 30 per 1,000 live birth. 30 per 1,000 live births. 30 per 100,000 live births. 30 per 100,000 live births. Now, let's look at the next question. Question 1. In a certain district, 15 women died from pregnancy-related causes in 1 year. How many women died? 15 women died from pregnancy-related causes in 1 year. And that represents the maternal deaths. Now, during the same period, there were 12,000 live deaths. Calculate the maternal mortality rate. So the maternal mortality rate will be the maternal death in the year, and that is 15 women died. How many live deaths? 12,000 live deaths. So we are going to have 15 over 12,000. Then you multiply your answer by 100,000. Okay, so 15. Let's do this calculation together. We are going to have 15 divided by 12,000. Then you multiply your answer by 100,000. Then you get 125. So 125 per 100,000 live birth. 125 per 100,000 live births. Now, in a region, 60 infants under 1 year died in 2024. And there were 5,000 live births that year. Calculate the infant mortality rate. In a region, 60 infants under 1 year died in 2024. And there were 5,000 live births that same year. Calculate the infant mortality rate. In a certain region, 60 infants under 1 year died in 2024, and there were 5,000 live births that year. Calculate the infant mortality rate. Okay, so if you want to calculate infant mortality rate, how many infants died? 60. Okay, died in 2024, and there were how many live births? 5,000. So you are going to have 60 divided by 5,000. Then you multiply your answer by 100,000. So the answer will be 1,200 per 100,000 live births. Okay, so 1,200 per 100,000 live births. Is that okay? Great. So that's basically how we perform the calculation. So the formula for maternal mortality is the maternal death in a year over the live birth in that same year. So in the question, we will always give you the maternal death, and you will always be given the live birth in that year. Then you multiply by 100,000. The same applies to infant mortality. In the question, you'll be given the number of infants that are dying in a particular year. Okay, then you'll be given the live births within that same period. Then you'll be asked to calculate for the infant mortality. So the number of infants that are dying divided by the live birth within that same year, then you multiply by 100,000. Now, the next thing we are going to look at is the perinatal mortality rate. The perinatal mortality rate. Now, what is perinatal mortality rate? Perinatal mortality rate basically refers to the number of fetal deaths. Okay, the number of fetal deaths. The number of fetal deaths and the death of infants under 1 week. Okay, good. The number of fetal deaths and then the death of infants under 1 week, or sometimes under 1 year of age per 1,000 total births. Okay, and that is basically going to include both the live birth and then the stillbirth within a given year or within a given period of time. Okay, now this perinatal mortality rate is an indicator that is very important. Okay, because you see, it's an indicator of maternal and newborn health. It gives us an idea of maternal and the newborn health. Is that okay? The reason is because it combines both, the newborn and then the maternal health in its calculation. Okay, it's going to measure the fetal deaths, that's the stillbirth. Okay, and then the early neonatal deaths. Okay, because for you to be able to perform calculation on perinatal mortality, you need the fetal death, which is the fetal death. Okay, and then you also have to get an idea of the early neonatal deaths. Okay, and that means the death of live born babies within the first 7 days of life. Is that okay? Per 1,000 total births. Okay, and that is both live birth and stillbirth within a given period of time in a population. And this indicator basically reflects the quality of maternal care. So it's very important in epidemiology. It reflects the quality of maternal care, the quality of the obstetric services that we render, and then the neonatal care in our health system. Okay, now if you perform this calculation, this rate, and then you get high perinatal mortality, it often indicates poor access to stillbirth attendants. Okay, and if you perform this calculation and then it's very high, the perinatal mortality is very high, it also tells you there is a possibility of inadequate antenatal care or unsafe delivery practices. So calculating this is very important, especially to the midwives. Is that okay? Or the obstetricians, the perinatal mortality rate. Now, the formula for calculating perinatal mortality rate is fetal death plus the infant death all over the live death plus the fetal death. Then you multiply by 1,000. The fetal death plus the infant death all over the live death plus the fetal death. Then you multiply by 100,000. The fetal death plus the infant death all over the live death plus fetal death. Then you multiply by 100. You multiply by 1,000. Okay, that's the formula. The fetal death plus the infant death all over the live death plus fetal death. Then you multiply by 1,000. Now, let's do an example. We have 10 fetal deaths plus 20 infant deaths, and the live birth is 1,000. Calculate for the perinatal mortality rate. Now, what is the formula? Fetal death. What is the fetal death? 10. Now, fetal death plus infant death. What is the infant death? 20. So, in the numerator, we are going to have 10 plus 20. All over. What is the live birth from the question? 1,000 live births. Okay. Then you add it to the fetal death again. What is the fetal death? 10. Then you multiply by 1,000. So, you are going to have the perinatal mortality rate as 10 plus 20 all over 1,000 plus 10. Then you multiply by 1,000. In the end, you get 29.7 per 1,000 births. 29.7 per 1,000 live births. Okay, now let's look at another question. 1. In a certain region, the number of fetal deaths is 20 and the number of infant deaths under 1 year is 80. The number of live births is 4,000. Calculate the perinatal mortality rate. So the perinatal mortality rate would be equal to, what is the number of fetal deaths? 20. So you are going to have 20 plus, what is the number of infant deaths? The number of infant deaths is 80. So you are going to get 20 plus 80 all over, the number of live deaths is all over 4,000 plus, what's the fetal death? Fetal death is 20. 4,000 plus 20. Is that okay? Great. So you are going to get, let's calculate it together. So let's do the calculation for the question 1. What's the formula? Fetal death plus infant death. What is the fetal death? 20 plus, what's the infant death? Plus 80. Then you are going to get 100. Now let's do for the live, the denominator. The live death plus fetal death. The live death is 4,000 plus the fetal death again is 20. So 4,020. So 100 divided by 4,020. Then you multiply by 1,000. Okay, so you are going to get 24.8 or 24.9. So 24, so the perinatal mortality rate is 24.9 per 1,000 births. 24.9 per 1,000 births. Let's look at the second question. In a district, fetal death is 35 and infant death is 60. What's the formula? So the numerator is going to be 35 plus 60. Okay, which is 95. Now let's do the denominator. The denominator is live birth plus fetal death. Live birth plus fetal death. Fetal death is 35. Live birth is 5,500 plus fetal death is 35. So you are going to get 5,535. So you are going to get 95 divided by 5,535. So then you multiply by 1,000. So you are going to get 17.16 or 17.2. Okay, and that means 17.2 per 1,000 live births. 17.2 per 1,000 live births. That's the perinatal mortality rate. So remember, the perinatal mortality rate is a very important measure in obstetrics and for the midwives. Why? Because it measures the number of fetal deaths and then early neonatal deaths, okay, per 1,000 total births. Now, the reason why measuring this indicator is important is because it helps to appreciate the quality of your maternal care. If you calculate and you are getting a higher values, it's an indication of, it's an indication of poor access to skilled birth attendants. That's the indication. Okay, and it's also an indication that there is inadequate antenatal care or unsafe delivery practices within the population that you perform that calculation or measurements from. Okay, the perinatal mortality rate. Now, let's do our last rate, which is the fertility and then the birth rates. The fertility and then the birth rates. Okay, now with the fertility, we will start with crude birth rates. Crude birth rates. Now, crude birth rate is basically the number of live births that occur in a given population during a specified year or period per 1,000 people in mid-year population. It provides a general measure of the fertility in a population, showing how rapidly a population is growing through birth, though it does not account for age-sex distribution. So when we say crude birth rate, that's the live birth over the estimated mid-year population. You multiply by 1,000. Okay, the live birth over the estimated mid-year population. You multiply by 1,000. Let's do the question 1. In a town, there were 850 live births during a year. The estimated mid-year population is 42,500. Calculate the crude birth rate. Now, what is the live birth? The live birth is 850. Divided by, what is the estimated mid-year population? 42,500. 42,500. Then you multiply by 1,000. If you multiply by 1,000, you are going to get 20. Is that okay? So 20 per 1,000. 20 per 1,000 per year. So 20 per 1,000 per year. 20 per 1,000 per year. So the crude birth rate is 20 per 1,000 per year. Let's go over it again. In a town, there were 850 live births during the year. The estimated mid-year population is what? 42,500. How many live births? 850. What's the estimated mid-year population? 42,500. Then you multiply by 1,000. If you multiply by 1,000, you get 20. So that means the answer, the crude birth rate is 20 per 1,000 per year. 20 per 1,000 per year. Now let's do general fertility rate. The general fertility rate is the number of live births in a given year per 1,000 women of reproductive age, usually 15 to 49 years, in a population. It is a more specified measure of fertility than the crude birth rate because it focuses only on a segment of the population capable of giving birth, women in the reproductive age range. Now, the general fertility rate, the formula is live birth. The difference is that, crude birth rate just use the estimated population, the whole estimated population. But then the general fertility rate use the reproductive age, women of reproductive age, as the denominator. Okay, so that measure or that indicator is going to give you a more specific measure of the fertility of the population. Is that okay? Great. So the difference is with the denominator. The crude birth rate uses the estimated mid-year population, the entire mid-year population, as the denominator. But the general fertility rate is specific. It uses women within the reproductive age category as the denominator. That's the difference. Okay, good. So the formula for general fertility rate is live birth over the women age 15 to 49 years. Then you multiply by 1,000. Now let's go into the calculation. Now, what's the so we have these examples. So 1,200 births in a population of 50,000. So the crude birth rate will be what? So 1,200 births. So if we are first of all calculating the crude birth rate. The crude birth rate, what is the formula? Live births over the estimated mid-year population. You multiply by 1,000. What is the live birth? 1,200. What is the estimated mid-year population? 50,000. Then you multiply by 1,000. You are going to get 24. So that means 24 per 1,000 live births. 24 per 1,000 per year. So the crude birth rate is 24 per 1,000 per year. Okay. Now let's do the second one. 1,200 births among, so the women of reproductive age is 12,000. So we have 1,200 births. Okay, divided by 12,000. Okay, then you multiply by 1,000. You are going to get 100. So that means that the answer is going to be, you are going to express or interpret this way: 100 per 1,000 per year. 100 per 1,000 per year. Okay, so the general fertility rate is 100 per 1,000 per year. The general fertility rate will be 100 per 1,000 per year, 100 per 1,000 per year. Now, this brings us to the end of the rates, okay, in epidemiology. Now, you need to understand that the reason why we are calculating rates in epidemiology is not just to, perform statistical calculations. Now, in epidemiology, the epidemiological rates are among the most important tools in public health and also in research. The reason is because it will allow us to measure, to compare, and also to what? To interpret disease occurrence, okay, within and across different populations. Now, one of the relevance of doing this calculation is that it will help you to be able to describe the health status of the population. It will help you or allow you to be able to make comparison between different groups when it comes to the occurrence of certain diseases, or when it comes to certain indicators within the population. It will help you to make comparison between two different groups or two different populations. It will help you to also identify trends that are occurring. Is that okay? Now, another thing is that it will help you to be able to, it will help epidemiologists or public health experts. It will help them, or it will help guide planning, allocation of resources, and also policy making. Okay. Now, it also helps public health experts to evaluate the public health programs and interventions. Now, these measurements or these indicators also support research. Okay. And, in research, one of the things it does is that it's support hypothesis generation or testing of hypothesis. Okay, so remember that we are not just doing calculations or performing these calculations in epidemiological rates just to, end up getting answers and then we leaves it there. It helps us to, describe the health status. For example, if you calculate for crude mortality rates, it will help you to understand the impact of certain diseases. For example, the cause-specific mortality. If people are dying from a specific cause, you perform the calculation, the cause-specific mortality for malaria is this. It helps you to appreciate the impact of the disease, to describe the impact of that disease. It allows us to also make comparisons. So you can calculate the cause-specific mortality for malaria in a particular region. Then you go and calculate the cause-specific mortality for the same condition in another region. Then you can compare that, within this period, there's the cause-specific mortality for malaria in town A. There's the cause-specific mortality for malaria in town B. Okay, to help us to make comparisons. Is that okay? It will also help us to understand the pattern of disease, the trend of diseases. Is that okay? And calculating these things would help you to appreciate, or to guide you in planning, resource allocation, and also policy formulation. Okay, so this brings us to the end of our lesson on measuring health, the epidemiological rates, and then indicators in epidemiology. Now, I would encourage you to support the channel by clicking on the like button. Make sure you subscribe to the channel. Share content with your friends and then your family, people, or anybody that you think may find this content or content on the channel very useful. I wish you all the best. See you in our next lesson. All the best. Bye-bye.